everybody should try to lose weight by themselves, and a lot of the patients who come and see me in my office have tried for years on their own to lose weight. I mean, obviously, there are some things that work better in terms of lifestyle options. So, for example, typically a low carbohydrate diet tends to work better. A high protein diet tends to work better. And there's lots of permutations and combinations with intermittent fasting, which have received a lot of interest in the last few years. So there's something to be said about using lifestyle options. But what we have to realize is lifestyle options are good for a small amount of weight loss and a short duration of weight loss. But if somebody wants to lose more significant weight loss and more long-term weight loss, then often these lifestyle options will need to be combined with other treatments. We have dietitians that work in our unit, which are very helpful to give advice on what are the most effective types of diet to follow, and certainly this is something that should be looked at. In terms of non-surgical options, there's been really in the last, I would say, 2 years, a lot of interest in pharmaceuticals or drugs for weight loss. And in my practice, I'm able to prescribe some of these newer drugs, which are actually a lot more effective than weight loss drugs used to be, say, 5 or even 10 years ago. And it all started with a particular subtype of drug, which is known as a GLP-1 analog. That's GLP-1 stands for glucagon-like peptide. And this is a hormone that we have in our bodies. It's there all the time. But this drug is basically an artificial form of it, which we kind of give to augment your own blood level. And what the GLP-1 does in your body is naturally it goes up after a meal. So when you and I have breakfast, lunch, dinner, then our own GLP-1 levels slowly go up. And when they go up, we get the sense of fullness. So that's what drives fullness. So now we have a drug that you can give externally and can amplify and increase that level of fullness. And so that's why this GLP-1 analogs are really very effective when it comes to modest weight loss. The current drug that is being sold as a GLP-1 analog is known as semaglutide, and the trademark is Ozempic. And we have clinical trials now which show that you can lose up to 5–10% of your weight loss with this medication, which is very exciting because this is more than any other drug has been able to achieve before. So it depends, which country you're in. In America, it's quite expensive. I think about $1,000 per month. In the United Kingdom, it can depend on the pharmacy you visit, but roughly the average price is somewhere between 130 and 140 pounds for 1 month supply. Now, this drug, unfortunately, does not come as a tablet, but it comes as an injection. But the good news is you only have to self-administer this injection once a week, and it's given into the skin as a skin injection, a bit like how diabetics inject insulin. So it's quite easy to learn how to do it, and you only have to do it once a week. So 1 month supply, so that's 4 injections, costs roughly between 130 and 150 pounds. Now, when we first give this drug out, that's not a guarantee that it's going to work for everybody. So we normally prescribe about 3 months initially to gauge if the patient is going to have a response to it. About 1/3 of people who go on this drug, unfortunately, do not respond. 2/3, it tends to work, but in 1/3, it doesn't work. So we have to try other drugs or other treatments with those persons. That's why it's only really worth giving a few months first to see if it's going to work or not, because there's no point wasting money on buying 6 months if it's not going to work for you. So typically, the best thing is to get a short duration, about 3 months, to see whether it works for you or not. And if it works, then we can carry on. If it doesn't work, then we try something different. Unfortunately, every drug has side effects. The good news is they're not too bad. They're not too severe with Ozempic or semaglutide, as it's known. Typically, patients tend to get some nausea, sometimes some vomiting. Diarrhea and constipation can happen. Fatigue is quite common as well, headaches. But for most people, these side effects are mild, and they usually get better the more you use it. For some people, the side effects can be quite strong. In terms of complications, one of the more serious side effects, but it's quite rare, is pancreatitis, which is inflammation of the pancreas, which can present with very severe abdominal pain. In that situation, patient has to go into hospital and obviously stop taking the drug. In some of the early research trials with these GLP-1 analogs, they found that when they were using this medicine in animal models, especially with rats and mice, there was a slightly higher chance of cancer and thyroid, but that's never been seen in humans. But I would suggest that if there's a history of thyroid cancer or thyroid problems, then probably we should be cautious with using this particular drug. So the GLP-1 analogs also come as a oral formulation or tablet. That's known as Rybelsus. It's available for the diabetics, and it gives some weight loss, but so far the semaglutide injections are more effective than the tablets. I should also mention that the semaglutide injections are at the moment licensed only for diabetes. They're not licensed as yet in the UK for weight loss. So they have to be used on an off-label basis. In terms of other more options coming up in the future, there's another drug out, unfortunately, another injection, which is called tirzepatide, made by another drug company. It's very similar to semaglutide. And this one seems to give even more weight loss, so around 15%. So we're excited to try using this as well in the future.